Hello runners and other athletes, I'm here to talk to you about anterior knee pain, and today I'm going to show you one of the most important things that you can understand and do to correct your body mechanics and get rid of your anterior knee pain or your lateral knee pain or even your medial knee pain. So outside, inside, and in front of the knee, there are some really key insights that I want to translate to you today so that you feel empowered to correct these things on your journey to becoming a better runner or to maintain the awesomeness that you already have. I want to specify, however, I'm a strong believer in comprehensive physiotherapy care. So it's important for you to know if you have just injured yourself, if you have an issue where it's difficult to walk. It's important that you see your physiotherapist and your provider, your physician, first before you go about doing any of these exercises. However, if you're looking for further insight to rehab that you're already doing, or just wanting to understand this further, wanting to try something to potentially get some insight into why you have this long-standing pain, then this is for you. So without further ado, I am going to show you the exercise that you're going to initiate that's going to give you some insight into your current body mechanics and how you're going to use it, the same exercise, to correct this. So whether you are a marathoner or you like to stroll with your dog through the forest or you have a different sport, this is for you today, and I hope that you gain a lot from it and become more empowered as a result. So here we go. I want you to, as we're doing this, you can pause it, you can replay it, but I want you to do this with me. So you're going to find yourself in front of a mirror. So this is my mirror, the screen right now, and you are going to come into a hip hinge. So for context, a hip hinge is going to look like gluteals back. I don't want the knee to come too far in front of the ankle, particularly if your knee pain is feeling uncomfortable. You can find a wall here as well, and you're going to hinge back about this far. So it doesn't need to be a really, really deep pistol squat. It's a hip hinge. But I want you to be facing front. So as you're facing front, what you're going to see is alignment. So here is good alignment. And the knee is going to have some relative unsteadiness based on your strength and control. So mine is not perfectly steady, but the alignment is such that the hips are lined up. The hip has a natural angle here, but it's not increasing. The knee has a bit of a natural angle, but it's not increasing in this way or bowing out. And you are keeping that relatively stable through your hip hinge. So important to know that this is what that's going to look like with your gait as you take your stride, as you run. That relative stability or instability is what you are faced with every day. And so if you have that knee bowing in or you have that hip bowing out, that's going to affect the forces through your knee, and we really want to change that to increase more stability through here. That will impact the knee and ankle. So this is what you're going to do. If you've discovered that you have some kind of instability, you're going to check either side. You're going to find a wall or a chair to help ensure that you have that stability, and you're going to hold that in relative alignment asymmetrically for 10 seconds until you feel a nice glute burn. And then you're going to repeat that. So you're going to do that about 10 times. And you're going to ensure through the process that there is absolutely no irritation to that knee. No need to make that feel any worse than it does. So that is really key for you. Now, is that the only thing that you're going to do? No. So it's really important that you understand other factors that affect the force of the knee. That might be tension through the quadriceps, which is not allowing them to fire as well as they should, or help to control the kneecap, which can be really crucial to people who have patellofemoral pain. You may not have strong enough quadriceps, in which case building that strength is going to be important. So there are other factors involved. So again, please see your physiotherapist, get some comprehensive care if you haven't already done, and then use this to guide you. It's important that you gain this as insight because this is neuromuscular. This takes repetition. Please be patient with yourself. Yes, you're going to find that there's strength that you're building here, but you also need to build that network, that connection from body and mind. And as you do that, or body and mind, as you do that, you will also notice and gain awareness through your run of how you're moving. And so you might find that you can make a little tiny changes where you are considering that knee alignment and helping to address any knee valgus, which is that knee coming in. You might find that you might be able to change that in your run, and as a result, have a relative greater comfort. You might be doing lunges, weighted lunges in the gym, and notice now that the knee needs to track properly in order for you to feel good through that lunge and not cause knee pain. So all these little bits of awareness will accumulate as well, and that's why I want this to be here for you. Please let me know if you have any questions. You can subscribe, and also if you do subscribe, please let me know a little bit about yourself in the comments below, and feel free to ask questions. I'd love to provide more content to help you with your success in the future. Thank you.